So good evening, everybody, and thank you for having me here. I think my talk is going to be quite redundant after Dr. Kavita's elaborate talk because I guess I'll be repeating a lot of things. How do you start? Start happens with planning a good study. So you have to, this is again coming together with what we have already seen in the prior talks. You need to you start off with a good plan for a study. You need to design a good question as to which you want to answer with your study. For that, you need to do a prior good literature review, read all the relevant articles on what topic you are thinking of addressing, and identify what are the lacunae in literature. So either you can add new information or you can add on to already existing information like our prior speakers have mentioned. But if you are going to be repeating that which is already there in literature, you may not have much scope for getting your article published, especially in a good journal. Sometimes, especially in a setting like Arvind, you may get away by having large data sets, like a large number of cases, but still you need to get some kind of new information about. So once you have identified this lacunae in the literature, then you need to go about figuring out and designing your hypothesis as to what is it that you're going to look. Based on that, you have to design a good data collection form or pro forma and structure either a pro forma. So we also have access when we have large data sets to enter our data directly into Excel. So you need to have a good pro forma. You need to include what all data you are going to include in it, or you have to design a good Excel for it. And following your data collection, you have to do a good analysis and you should be able to guide the statistician as to what you do. Now, my original plan of this talk is to actually literally talk about how to write an article. So it's going to be quite repetitive of what this is just the introduction. I haven't talked much more about how to go about planning a study. So components of an original article are the title, the running title and keywords, abstract, and the main article, which follows the IMRD format, which is the introduction, material method, results and discussions, and references. So the Equator Reporting Guidelines, these are a simple structured tool for health researchers to use while writing manuscripts. And it provides a minimum list of information required that to ensure that a manuscript can be understood by the reader, replicated by a researcher, used by a doctor to make clinical decision, and included in a systematic review. And there are many such guidelines. So if you visit the Equator Network website, there are many guidelines. The main ones which we require are the Consort for RCTs, Strobe for observational studies, Prisma for systematic review, Record for retrospective, and there's CARE for case reports. If you are unable to decide which is the checklist that you require, there are two ways you can do it. One simpler way is the IJO website. In its author instructions, it mentions these and gives you a link to connect you to the Equator website. So that's a simpler. Otherwise, if you just go to the Equator Network website, there is a tool there wherein you can enter information about your study, which takes you to which is the required checklist, or there's just like a huge long list of the checklist, and that itself you can just read through it and know. There is also a tool there wherein you can download a fillable form of the checklist. So if you are writing a paper on an RCT, there is a downloadable consort checklist there. There's a downloadable strobe checklist there, which is very easy to download and which can be filled in by you. Those basically you have to follow the checklist obviously and include all those points in your manuscript when you write it. And then when submission, you need to mention in which page you have addressed those particular points. So that checklist is very easily downloadable and can be very easily filled. It looks and sounds very scary and intimidating, especially when you're doing it in the beginning. But if you go to the website, it's really very easy to follow it over there. So the manuscript, you have the introduction, material methods, results, discussion, and references. The introduction should be succinct. It should be to the point, not more than 3 paragraphs. In the first paragraph, so if you look at this particular article of ours on the clinical profile and outcomes of rheumatogenic retinal detachment related to trauma in pediatric population, the first paragraph talks about ocular trauma. and what happens with trauma. And then we go on to ocular trauma in children. And then we talk about retinal detachment due to it. And we end it by stating our hypothesis or stating what is it that we are trying to inform the readers about in this study. It should not be, again, as Dr. Kavita has already mentioned, should not be too extensive, should not be too large. It should just lay the opening for your article, just like appetizers lay the opening for the main course which is going to follow it. Then comes your materials and methods. This is literally just telling others what you did. Some important points to mention in this are the type of study. You have to write a statement on the Declaration of Helsinki and about the Ethics Committee approval. The material and methods should appropriately display what data did you collect. What was your source of data? So if it was a prospective study, you would be talking about what participants you recruited in that study. If it's something retrospective, you would be talking about how you got that retrospective data. So in case that we went through the electronic medical records and ran a search for suppose central serous retinopathy and something related to it. Okay, and that is how we got the data out of it. Of course, you would have defined your inclusion and exclusion criteria. This is something you would have done when you designed your study. You need to mention them here, and that will also help you define who your participants were. So who were the people who were recruited for the study? So like in this imaging on smartphone-based imaging for diabetic retinopathy, the participants were more than 21 years of age who visited Arvind Eye Hospital between these particular dates. They had clinically gradable DR, all of these particular points, which were basically our inclusion criteria. Okay. Patients were excluded if they had significant corneal or lenticular pathology. All of these are your exclusion criteria. You have to give a statement on how your sample size was calculated, which would also have been done prior. Retrospective studies usually would not have a sample size calculation. Prospective studies would definitely require one and would not be acceptable without this particular. And then you have to enlist what all data you collected. Now, what happens is many a times we collect a lot of data, but we may not be presenting that data in our results, because usually to take a step back from this, it's a good idea to collect everything that is collectible, because you don't know what you may want and it's not possible to go back and collect. Even if you're doing a retrospective study and you have screened 200 case sheets and included 75 case sheets, you can't go back to 75 case sheets to pick up one data point again. So it's good to sit down and extensively think as to what all information you want to collect and collect it. If you find it to be redundant later, you may not present it in your paper. But going back and recollecting from so many people, and in a prospective, it's practically impossible because those patients are already gone. So if there is data that you have actually collected, but you're not going to be talking about in your paper, or you have decided to write 2 papers from that data set, and one particular bunch of the data goes to the other paper, you do not talk about it in the methods here. Just because you collected it as a part of that study doesn't mean you write it here if you're not presenting it in your results. Then if there is any particular process which was carried out, that process, how you did it, needs to be described. The basic aim of material and methods is somebody else should be able to replicate what you did. So again, if it's like in this imaging paper, we are written dilated fundus imaging, how it was done. Remote interpretation of the photographs, how it was done. So if somebody else wants to do an imaging study tomorrow to validate some kind of a device, they can look up this methodology and they can say, okay, this is a good methodology, let us follow it. In a surgical paper, you need to describe the steps of your surgery. You may give photographs or a supplementary video to show your surgery. In a treatment paper, you need to describe the treatment protocol. Like in our paper on the use of Avastin in babies with retinopathy of prematurity, we have described which babies received Avastin, what were our clinical criteria for it, when they received it, how was the actual procedure done, how they were followed up, and at what point was laser done, at what point was EUA done. All of this is described. And you have to, of course, define your outcome measures, the primary and secondary outcome measures, which is basically what you had predefined when writing your protocol. and which is also what is going to be mainly displayed in your results. After this, we come to results. This is the main crux, the soul of your paper. This is where everything lies. This needs to be supported obviously by a good data which was collected through a good study which was designed, and then by a good analysis by the statistician. Relevant flow charts can be incorporated. So again, there are these consort flow charts and all which you require for study. So again, this is from our study on ROP, and you can see how many babies were screened during that time, how many babies received bevacizumab, 7 babies lost to follow-up, 1 baby died. So 63 eyes were included in the study. And then this is what were the outcomes of those. So these kinds of charts can be given, and you can report data in a correct manner. We had an excellent talk by Dr. Divya just now about how different. Remember, your data should include p-values, confidence intervals, depending upon which value you are giving. So if it's mean, you have to give standard deviation with it. If it's median, you have to give interquartile range with it. When you're comparing groups, you have to give a p-value with it to establish significance, whether it's there or not there. Now, results can be displayed in the form of tables, figures, and descriptive. And you should not be repeating the data in this. So the descriptive is the kind of the cement which holds together your blocks of your tables and figures. In general, most journals allow a limit of 5 figures and tables put together. It varies, but this is the usual average. So since we would we have to be ready to resubmit to different journals, it's good to format our article in that way. You may have some journal which allows you to have 6 or 7. You do that, then when you come back, you may have to convert something to supplements, or you may have to delete and rewrite something. Sticking to these general outlines makes it easier for resubmission. Table 1 typically, usually is the demographics table. And the last table can be a regression analysis table if you have significant data points in the regression analysis to present. Figures, again, look at what data looks better rather than reads better, and whatever looks better. Also, in articles, having a graph or two, adds some color to the black and white imaging rather than just having tables and written. And of course, clinical images very relevant wherever it is possible. Descriptive data should not repeat what is in the tables or in the figures, but it should mention table 1. So if you're talking about demographics, it should highlight relevant points there. Or if something is mentioned there and there is another demographic additional point, you may add it here. Like, for example, in your table, you may have represented age as a categorical data of 0 to 20, 20 to 40, 40 to 60 years. And in your descriptive, you may write the study participants had a mean age of so-and-so, standard deviation this and this. So that could be how you could represent it. Of course, your table and figure should be cited, as in mentioned in your results or wherever, or in your paper wherever. Like figures can come in areas, can come in methodology also. Okay. So like if you look at this particular paper of ours on scleral fixated IOLs, we had a large table 1 and table 2 giving a lot of data because we had the data compared between sutured and sutureless SFIL techniques. And we also had it compared between people who received SFIL following trauma or those who had aphakia following cataract surgery. So we have everything. We have the mean age happening here, UCVA happening here and here, the reason for aphakia, any previous surgery. So they are similar-ish tables, but they give the comparison between the two groups with the p-value and all. This is another regression analysis table from another publication, which gives us the data on the various different factors which were studied over here. And like Dr. Kavita just mentioned, the table should be able to be read on its own. So you have you should have the heading, you should have the footnotes, and it should be interpretable independently on its own. And graphs. So here, this was again the same article on traumatic retinal detachment following trauma in pediatric. So this is what happened, what were the complications we saw. And some children had attached retina in the end and others had a detached retina as the final outcome. And in those particular eyes, how these complications fared. Or in another paper looking at what brought diabetics to the eye. This is a bar diagram showing the presentation, what was the diagnosis of these people at presentation. So these are various ways in which diagrams or graphs can help make your paper more attractive and present your data. So if you look at this, you can see that 26% of diabetics who came to our hospital had diabetic retinopathy at first presentation. 17% had cataract. Another 25% had DR and cataract. So that makes like 51% had DR at first presentation to an ophthalmologist. And 25% came for refractive error. So by just looking at this graph, you know the importance of the condition that is happening. This is again the paper on HRF. We had clinical images because you need to show what is it that you are calling HRF. For somebody else tomorrow who's going to read that paper, it's not just a description of this was called HRF, but you need to show them images of what it is. When we graded the fundus photographs, we needed to show what images were called excellent, what were called acceptable, what were the various angles which were photographed. All of this data is given in these kind of attached images, which is another way in which you can represent both results as well as your methodology. It can be a part of your methodology also. So results should be presented in a sequential order. You have demographics, then data on your main study outcomes, then comparison between any groups, complications, and regression analysis. Then you come to discussion. The first paragraph should summarize the main outcomes of your study. And then you discuss each point in sequence, similar to how your result has gone, one by one. Cross-reference it with appropriate literature. Cross-reference it with literature which agrees or corresponds to your findings, as well as literature which is opposite to your findings. It need not always be the one which corresponds. Somebody else may have found the opposite and you may have found something different. And then you can also add over there your hypothesis as to why it was different or why it corresponded. And acknowledge your study limitations. This also Madam just now highlighted. You have done the study. You know where it is lacking. What are your limitations or biases? Always good to have a paragraph on limitations. But don't go so overboard that the reviewer will think this is of no, not worth it. Conclusion, it should summarize your key findings, give recommendation on the basis of this, and you can state implications for further clinical practice or policy making. Based on journal policies, you may need a different conclusion as a heading, or it may be just the last paragraph. So here, this is about an AI algorithm for screening for DR. This this journal required a conclusion, whereas if you look at this is again the ROP article, limitations are absence of longer follow-up and to conclude. So these are as the end of your discussion. References, most journals allow 40 to 50 references for an original article, but usually a number of around 25 suffices. You should not go over the board. Choose references well. I think that was an excellent talk about using a referencing manager and organizing your references. And I think that should be what everybody should follow. No manual referencing anywhere. That should not be done. And read your article. So, it's, sometimes there is one article quoted to say male predominance seen in CSR, and then some other article quoted to say some other point. But if you go to see, there might be one article which actually covers both the points sufficiently enough. So you can do that. And again, like I said, similar findings, opposite findings, and you need not quote all the articles available. Certain topics can have extensive number of articles, like ROP, for example. There'll be hundreds and thousands of articles. Just quote the ones which are relevant. Use a reference manager. Many referencing tools are available. I think the references get updated. And when you use the referencing manager and you create your manuscript, it is linked to your referencing manager. So whenever you edit or change it, or you add a new sentence, so you have written a whole thing, and then you add a sentence somewhere in your introduction, and you add a reference there, and you refresh, it will automatically refresh your citations. So this linked manuscript is very important, but journals require it to be unlinked when you submit. So remember, when you are submitting, to save a linked copy and then submit and then unlink and save a different copy. Because when it comes back for revision, if you are changing things, if you're adding a new reference, or you're deleting something, or you're adding a sentence which is citing one of your already present references, orders may change. And that's when you need your linked article. Otherwise, you will not be able to do it. You will again have to redo the whole thing again. Believe me, this can become tedious. So then after this, you come to abstract. Most journals for original articles require structured abstracts. Case reports, they require unstructured. Review articles can be unstructured. Usually have a word limit of around 250. So again, the subheadings may differ. Some may say purpose, some may say background, some may say aim, methods, results. Some may have a study population as an extra one. But still the word limit remains around 250. So when you write your basic abstract, keep it around that limit. So when you are just changing it from journal to journal, you can just change the headings. Sometimes when they have study population and methods separate, one line from your methods gets deleted and it gets added over there, and it makes your life easier. Keywords are the key to your article. Choose appropriate keywords to ensure that your article shows up in the searches. This was also extensively discussed. And like Madam said, keywords should also feature in your title. So writing ordered, again here, I agree with what Dr. Kavita just said. I would write the methods first, then I would write my results, get my results, what I want to display finalized. On the basis of that, I would write the discussion and sometimes introduction simultaneously, because when you're reading literature, you'd be like, this point, okay, maybe this is good to put it in the introduction, but this other rather elaborate one, I'd put it in discussion. After everything is done and you have decided what is your main focus of the article going to be on, then you write your abstract, because your abstract just has to write the highlights. So you should not be highlighting something different in the abstract and something different is spoken about in the article. And finally, a good title. Title should be precise, should reflect what the paper is about, and should ideally include like the randomized clinical trial or prospective. Like Madam's LPI, we saw a randomized clinical trial was mentioned in the end. It should ideally include these points. Proofread, check your spelling and grammar using the automated check. See that you have used consistent language throughout. Check the flow of the article. Sometimes we write bits, sometimes it doesn't flow very well together. You may need to put one point above and another point below. See that it goes in a good, smooth flow. Keep your data safe. Put a dedicated folder on your laptop. It should not be on your C drive or desktop, because if your laptop crashes, that is what gets formatted. It should be on your ancillary drives, or save it to the cloud, because that is what is very easy nowadays. Make subfolders, put your articles separately, put your data separately, write your manuscript. Save every version of your manuscript. Label your manuscript with manuscript, your initials, year, month, date. Putting the year first and then the month and date makes it come chronologically. So you know which is the oldest to the newest version. Save every version, because you may delete off something now and later on somebody may ask for it. Use track changes when editing the document. Use comments to write anything that you want to remember to add later, or you need to check a point, or if you're collaborating and writing it with somebody else, to pass on information to them. And finally, the journal submission. We have also had an excellent talk about this in the beginning. So you identify the appropriate journal. Journal suggesters are there. Read the author instructions carefully. Format your article carefully, and then let your article sleep. Keep it for 5 to 7 days and then revisit your article. All your co-authors should have read it, and ask somebody who's not involved in your study to read it, because my child is the best baby in this world. That's how it is. So you don't want that to happen. You may not see lacunae, you may not see absence of flow, you may not see grammatical errors, and sometimes your point may not be coming across, because what is it in your mind, you may be reading it in that way. So it's good to ask one of your colleagues who's not a part of your study, who hasn't worked, please read my article and point out what you may find deficient in it. And then responding to peer review, I think Christy is going to talk about it, so I won't go into much details. Instructions would be there on the article author instruction or in the email which comes to you. Usually you need to incorporate their suggestions, but if you find that something is not really necessary, you may write a polite rebuttal to it. Promote your research, document your research by sharing a PubMed bibliography, have an ORCID account, have a Google Scholar account, have a ResearchGate account. Make your research accessible by presenting it at conferences, by sharing on social media. This can help you increase your networking and collaboration with other people. And finally, let your article fly. And hopefully this will help you succeed and not just remain an et al. Thank you.